Thank you, Senator Jackson. Thank you, Chairman Bronstein. Appreciate it. Thank you to the committee, to the panel for all their insight and their testimony. I actually, what strikes me is the mental health aspect. I know firsthand about the mental health issues that families could be facing. My mom suffered several nervous breakdowns while I was growing up, and I understand the strain on the community and the family bond. I can only imagine what's going to happen after this pandemic subsides, at least temporarily. So I think the main point that I'm looking to gain some more insight in is what we can do to give more resources, not necessarily funding wise, because I know that's always going to be a reason and a need. I'm looking for what we can do at the ground level in each community, because I think along with that mental health aspect, we're going to see uh, a dire need for uh, beds, detox beds, I should say, because the isolation, I think, is going to bring about more substance abuse, whether that's drugs or alcohol. Uh, we see that we're losing some detox beds throughout the city, and the state, and there's always been a need. Is there anything that we should keep an eye on? And this is open to all the panel members. If you can give us some recommendations and suggestions in that area. Thank you.
Sure. So, I mean, you're absolutely right that substance use is going up, and we've heard from a lot of our providers of, people who are experiencing relapse or really struggling with kind of the structures that had helped them going away to a large degree. You're not going to work every day. No one knows if you open a bottle of wine at noon or whatever. But I think in terms of resources, I mean, I think you highlighted a couple of key issues. I think a lot of it is also thinking about, the conversations we have and how we direct people to the resources that we have right now. So, and the resources that we can build. So I know the state has already applied for some FEMA funding and is intending to apply for more for FEMA's crisis counseling. That I think can be a really powerful program, certainly was in the state and the city after Hurricane Sandy and after 9/11. And then also for our kids, thinking about the resources that we have in schools and how we can make sure that those resources stay in place when students aren't in school and aren't attending, some of the after school and enrichment programs. So, a lot of schools have social workers. How are we making sure that kids are still accessing that? And that, last year, New York State, thanks to all of you, has started to do mental health education in the schools, which is wonderful. How can we make sure that those sorts of things continue when students aren't in the traditional settings? So those would be two things I would keep an eye on.
So I know that we've always needed more SAPIS in our schools. Is there a specific targeted area where we would want to make sure that we advocate for more of those, professionals?
Sure. So I don't know the breakdown super well, but I would say certainly where we're probably going to see the greatest increase in need is going to be in those communities that are the hardest hit. So looking at, where have there been the most infections and the most deaths, obviously kids processing loss is really complicated and really hard, or processing that, maybe your mom is a nurse who didn't come home for 3 months because she was afraid of getting you sick. That is going to need help to help those kids be resilient and to go on through their lives.
And I think switching gears a little bit, the CDPAP for seniors and disabled, having their families take care of them. I think we're going to see that there is a great need for that and want, especially given the impact this has had on nursing homes. So I want to know if there's any insight you can offer in how we can advocate more for that. I mean, I know that we have to push for the budgetary hearings for these things, but we see that this is more important now than ever and we can't have those programs cut.